Hi Bahar. Welcome Bahar to our journey together. So it's Ekta and Pooja. So welcome to our journey together. So in this channel, what we are trying to do is we are trying to work together with different people and understand various holistic modalities so that we can know about various things like Reiki, sound mantra, and you would be today, we'll be discussing with the Body Talks. So welcome to our channel, Bahar.
You. Thank you. Thank
Hi,
you for
Bahar.
having me.
Welcome to our channel. As just Pooja mentioned in the journey together, we would like to hear more about Body Talk. So just a little bit about you for our viewers. So Bahar Negi, you are the founder of HeartSync, and you have been a passionate holistic healer, as well as you have been helping people into their journeys in their self-healing. You practice a lot of, if I'm correct, you practice a lot of modalities, but one of them is body talk therapy, and we would like to hear more about that today. So over to you, and if you can share your journey, how you got into it. Thank you.
Thank you, Ekta. So uh, when I had my first child, he had some different issues, physical issues, and eczema and things like that. And I think that's kind of what sparked my interest in natural therapies, because I wanted him to be well. I didn't really want to use too many steroids and things like that. So went on this journey trying different therapies, trying nutrition, naturopathy, homeopathy, and then I obviously found that they all helped. They all, definitely contributed to his health. And then I just discovered Body Talk, and I thought this is something very unique because it kind of merges all these different modalities like Eastern medicine as well as Western. And when I started having some sessions, I really liked the system, and I like the fact that it's very gentle and non-invasive, so it can be used on anybody, including a pregnant woman or children, babies. And so that's why it worked really well for me to learn Body Talk, because I could use it on my young family at the time. I just discovered that it helped all family members to heal, and it's sort of a system that looks at the physical as well as the emotional components of healing, psychological. So it's a whole healthcare system, and it's incorporating all the different modalities into it. But that's how John Veltheim, the founder, kind of developed through his own, he was a teacher, chiropractor, acupuncturist, and Reiki practitioner, and he combined all these therapies together, and it helped him heal as well as, to heal others.
That's very interesting when you said that, it combines multiple alternative therapies.
Yeah.
Uh, so how exactly do you do,
How does it work basically? I mean,
exactly?
Yeah, so how it works is we use biofeedback. So we ask the body through a muscle test. You can just use the arm muscle and ask what needs to be, what the priorities of the body are, and then once you've kind of got your what you need to balance out, there's some light tapping that happens, that you do light tapping on the head brain. And then on the heart is also considered to be like a brain, because it's very intelligent, and on the gut brain. And the tapping helps the body to, stimulates the body to then heal whatever the problems are. So once you've found could be, external environmental factors, emotional things, or it could be physical things, and organs in the body that are not functioning optimally. And by doing the tapping, you're stimulating the body to heal. So the body has the ability to heal, but what happens is there's a compromise in those lines of communication. And with stress, with external factors, we're just not able to heal as quickly as we could, and as well. So by doing this, the body then self heals. So we're just facilitating the healing. So there would be some talking, a little bit of talking as well, asking what, getting to know, to tailor make the session to the client, but also, asking the body. So the body has got the wisdom. And so that's how the session would be done. And, there'd be maybe a little bit of, linking the different parts that need to be, to communicate better, and helping them to facilitate that healing.
Is there any
More
specific things that it caters to, like, you were saying eczema, or anything related to pain, or is there any specific where you can target body talks or therapy
And I
for?
was thinking, like, is it just the physical healing that you're doing, or is it like situational healing, basically, we can do?
Yeah, it can be both, because everything is interlinked. And so even if someone has eczema or a physical issue, there's always possibly likely to be an emotional component to that. There could be some emotional factors, there could be some environmental factors. So we're always going with the tailor making it to that person's body, but it can, because it's got, you're always asking. So it can be, the scope is, it can be whatever the person has. So it can be pain, it can be like, period pain, muscle pain. It can be an emotional issue, or somebody has a learning difficulty, it can help with that. Or it could be, some kind of PTSD, depression type of issue, or even if there's a physical issue also in the body, it's always about communication in the body. So if something is not working properly with the liver, or with the lungs, or with any part of the body, by improving the communication there, then that can start working more optimally. And because it's also cumulative, as you do sessions, the body can then remember how it had healed before. So, for example, I used to get a lot of coughs and colds and things as a youngster, and it'd take me ages to heal. And then, as I've been doing BodyTalk for a long time now, I've noticed that if I do get a cough, I still maybe get it, but my body heals faster, because your body's got that intelligence now, and you've stimulated it, and then you do a technique to help it heal a body chemistry technique to help heal the viruses, bacteria, whatever it is that is causing the problem. And it can heal a lot faster. So that's where it's really beneficial to, when you're going for a long time. And the thing that if the session is, if, for example, the links are not correct, nothing would happen. There's no downside that, for example, you give a remedy or you give something and there could be a side effect. So that's another thing that I was attracted to, the fact that you can't do any harm, because I think that's really, especially working with babies or pregnant women or something, you don't want to have. I've had a reaction in pregnancy to a homeopathic remedy, and I love homeopathic remedies, but that particular reaction, I didn't, it was quite not very nice. So I would be a bit more careful in those types of situations, because sometimes you're oversensitive when you're pregnant and things like that.
I think, Ekta, your question was slightly different than I thought initially. It's same. I think you were asking for specific areas.
Yeah, so in specific areas, it can be in any sort of area. So, like pain, trauma, emotional issues, and anything that you can think of, really, because you're always tailor making. You're going to ask the person's body what needs to be balanced to heal that situation. So,
Right. Do you have any case studies that you can share with us and our viewers?
yeah, so I've worked with, with things with learning difficulties, and I found that even with me, that helped a lot when I had earlier had some issues with learning and things like that. And with autism, working with children with learning difficulties and autism, they sometimes don't want to be physically present in the session because they can't sit, for a long time. So it can be done as a recording, and we have a tool to tune in to that person and do the session long distance. So it doesn't have to be on Zoom if they can't sit. It can be like a recording. So in this case, the child was having difficulties. He was just started school, and he wasn't speaking, and finding that he wasn't able to sit for a long time. So doing sessions, his teaching assistant was saying he can sit longer, he can concentrate better, he's not having tantrums like before. He had a baby, new baby come into the family that caused also upset with him. So there's like a jealousy going on, and then there was some fears, fear of water, aversion to certain foods like vegetables, wasn't eating them. His mom was concerned about that. So those kind of situations, you can help the person to the body to balance again, and for them to have a less of a reaction to things, less of a reaction to the environment, and to, if they have developed a fear of something, can address that as well.
All right, okay.
Sessions generally, I know it would depend on the situation to situation, but normally, how many sessions do you recommend? Is there any particular?
Well, I mean, like, it depends on the situation, but I usually work in 3. So, if people come for 3 sessions, they most of the people I've found have said, oh, this has changed, or this has improved, and there has been a significant change for them in that time, because in one session you can't really see it depends, what have they done before also, and maybe they've done other modalities, but this is a different system, and we're working on all levels, so the emotional and the physical. So at least 3 to 5 sessions to see changes in what they're dealing with. But if it's a chronic issue, then of course they probably would need more sessions. It depends. But I mean, I've had people come in also for depression, and like within 2 to 3 sessions, they've said they felt a lot better, and they don't, their medications are reducing, and so it's just depends on the person.
If anyone wants to go into this path and become a coach or a holistic spiritual healer, basically what do you call BodyTalk therapist. So what's the path that you would recommend that person to take?
So if they go to the International BodyTalk Association website, there are all the courses listed on there, and obviously right now in-person isn't happening, but there are online courses as well. And as things open up, there'll be local courses in different countries, always running, ongoing throughout the year. So they would need to be a practitioner, if that's what they're looking to be, then you'd need to attend the fundamentals, BodyTalk fundamentals, twice. So you attend it once, you go away, and then you come back and attend it again, and you do an exam, oral and written exam. And you'd also need to do 50 case studies on 15 people and receive a few sessions as part of your own growth. And that, you could, it's, in terms of time, it like be 6 months to 2 years, depending on how much time they have to, spend on it. But that's just to be a basic practitioner. And then if they want, there's an option to do the advanced certifications and things as well. And there are other courses through the campus, the online campus. And there's an access course, which is a short, it's like a maintenance program that anybody can do, which you can use on your family. So it's like a maintenance for your everyday health. And that's a 1-day course, which anybody can do. There's no requirement for that.
Got it.
I'm just wondering, because I remember I had taken one session for my son long before, one or 2 years back, when he joined the new school, and he was not, he was not able to make friends or something. So it really helped. So I'm just trying to understand, like, we know how Reiki works from distance and other things. So how does, like you said, it's a combination of different modalities, but how does it actually work? Do you do you go into meditation and talk to the body? How does it basically work?
So we have a, like, if you look at kinesiology and muscle testing, biofeedback, they ask yes and no with the muscle. So it's kind of like that, where we're asking the body, what the priorities are. Is this the priority? There's a yes. Is this a priority? That could be a no. And as long as you have no agenda and you are you're just present for the person and not having your own agenda there, then you can find out what the body needs. And obviously it takes training, and meditation can help you to get to that place as well. We have Mindscape, which is a program that helps you to get into that brain waves where you can access more information in the subconscious. That's another course through the BodyTalk Association. And so we're just finding out that the person, maybe they have some emotional thing comes up, and then maybe there are some physical things going on. Maybe there's a gut issue going on, and we know so much about the gut now, that the gut influences our emotions, our behavior. So if the gut's not balanced, we're not going to feel good. So we could be incorporating that, like in the case of somebody not feeling emotionally comfortable. And then it's always going to be different, but usually these are the kind of things. They could be something could come up from an active memory that happened in their past, and we don't have to delve into it, but just identifying it, that helps the brain to access it. Because it's like, if you think about your computer, if your computer is running for so long, and it's going slow because it's got so much to process. And when you leave it overnight for defrag, in the morning it starts working faster again. So this is kind of what you're doing, is you're defragging the body, you're defragging the all those emotions and things, and then the body can process it and let it go. Whereas if we're more stress is coming in, and from here and from here and from here, then the body can't process it and the brain can't process it. So the brain balancing technique called cortices is a technique that helps the brain to recognize, just to rebalance by placing the hand on all the parts of the brain, and doing some light tapping on the head and on the heart to store the change, and on the gut brain as well. So by doing that technique, we're just helping to rebalance the brain, and the brain gets stressed out from using our too much of computers and other stressors in the environment. So doing that technique repeatedly is a way also of helping the body to cope with stress. That's kind of like the foundation technique of BodyTalk. So yeah, it's different ways, different techniques.
It's amazing.
Yeah. Interesting. Yeah, like you were saying, it's energy as well as like Reiki and pranic healing, as well as tapping. So it's definitely a accumulation of all these modalities blended together.
Yeah, I also bet because it's a system that you can integrate with other systems. So many practitioners have different modalities that they do. So I do SECM, lymphatic drainage, but I do the Veltime method, which is the BodyTalk method, which can be done energetically. So most lymphatic drainage has to be done physically, and it can be a little bit, not everybody can receive it, but this one is very gentle. It can be done energetically again, so they don't have to be physically present. It can be done on anybody, including pregnant women, because it's so gentle. And so we would always ask, so maybe if somebody's not sure, we would say, okay, do they need lymphatic drainage? Do they need BodyTalk? And if they themselves are not sure, we can check. Or if they just want to go for BodyTalk, that's fine. And sometimes the lymphatic drainage section can come up, a section of it can come up within the BodyTalk session. Not the whole thing, because that's quite long, but if the whole thing comes up, then it would be another session. So I incorporate that. I incorporate SECM, which is another energy modality, if they come up in the session. So it can come up under other modalities. Also, it can come up that they need to be referred to somebody else. Somebody else has got what they need. So they need a doctor, then they have to go to the doctor because they have their own skills. Or they need someone else, a nutritionist or something, it can come up. It's not that often, but it can come up like that as well. But a lot of it can be done, yeah, it can be done this way. So even acupuncture points can be balanced energetically without needles. A lot of points can be balanced by bringing the energy to those points once you know where they are. And yeah, bringing energy to various organs and things to help them function better, because what happens is the energy just gets blocked in those areas for various reasons. So by helping those lines of communication to be, you know, unblocked and improve the flow, then they can function more optimally.
Got it.
That's
Very
really
good.
good.
Thank you so much, Bahar. I mean, you know, it was a very insightful session.
Yeah.
Thank you. Thank you so
Thank,
much.
thank you so much.
And
Thank you.